Hi everyone, my name is Emily and I'm going to be presenting on hypokalemia this week. Hypokalemia occurs when there is lower than normal levels of potassium in the blood or less than 3.5 milliequivalents per liter. Functions of potassium include nerve conduction and muscle contraction, especially the heart muscle. Some causes of hypokalemia include a low intake of potassium in the diet, and this may happen with eating disorders or excessive alcohol use. Diuretics, which are prescribed for patients with heart disease, for example. Diarrhea and vomiting due to excessive losses of potassium. Chronic kidney disease and diabetic ketoacidosis, which is treated with insulin. And the presence of higher levels of aldosterone or glucocorticoids, as in Cushing's syndrome. Some common signs and symptoms or effects of hypokalemia include weakness or fatigue and muscle cramps, and this is due to lower neuromuscular conduction. Anorexia or decreased appetite and constipation, and these are due to a decreased GI motility. Paresthesias, polyuria in severe cases due to renal impairment, and most importantly, and the most dangerous effect is cardiac dysrhythmias. One EKG sign that you may see first is a U wave. Diagnostic testing includes a serum blood test. And below are my references.